if you do too often, then.
Well, they just asked me all kind of questions. People love me to go live every day. But I don't. Oh, gosh. Hey, guys. Come on in. Yay. Yay. Come on in.
Everybody says, hey, sis.
Hey. What's going on? Yes. I got some news to share. Yay.
Looking flawless. Everybody's saying that you're gorgeous, like usual.
Thank you.
I'm never saying that about me.
I mean, you know, she's kind of outshining you a little bit right now.
I understand that, but show the girl some love. That's what I'm asking.
Love you guys. Miss you guys. I need to do a live more often. I don't do them as often as I should. Yeah.
Okay, they're saying nice suit, nice bow. Okay, there you go.
Thank you. You know, should have brought some love.
You know what, Rachel? You just might want to make sure you turn the volume up on both phones.
Okay. No problem.
You know, just make sure they're all the way up. And there we go.
Good.
Let me know when you're ready.
I think we are ready. We have over 2,000 people on.
Okay, and plus it's going to be up so people could still see, yeah?
Exactly.
Okay, so hi guys, it's Nene along with Dr. Okoro at Georgia Plastic Surgery. And I got a little bit of good news to share with you guys. I just signed a brand ambassador deal with Dr. Okoro and Georgia Plastic. So we're going to have some fun and do some beautiful things for all of you women out there who want to drink the fountain of youth. This will be the guy that you come to, okay? It's actually his hands and not the water that you're drinking. So today, Dr. Okoro wants to have a Q&A about BBLs. Obviously, I don't have a BBL. I'm not opposed to getting one. And I'm going to do a few things that I will share with you guys over a period of time. I'm not saying what I'm going to do yet, because a lot of you guys already think that I've done everything anyway. They think I've done everything and I haven't, and I need to do some stuff now. Now that I'm at this chapter 50.
You're 50?
Chapter 50.
Wow.
It's time to tune up maybe a little bit. I've held up good, Dr. Okoro. You gotta give it to me now.
Yeah,
it's in my DNA.
That's right.
I'm telling you, my mama done made me a good child. Skin still holding on, arms ain't swinging. I see a lot of women, you know, that become birds over a period of time with wings. I don't have any wings. I don't get any. So I always say, you tell me what you think. A little bit here and there over the years keep you looking good. You think?
I mean, it's not about those. I think, you know, prevention is better than cure.
Prevention
is better than cure. You can actually take care of yourself. You can eat well, exercise.
Yes.
And when you get to chapter 50, it's time to do some tune-up. Just like you do tune-up for your car. You know, you can have the best car. You know.
Well, I have a question for you because I obviously in the industry where I see a lot of women in their 20s and 30s that are doing BBLs already. You know, boobs are just, you know, people are giving them to their kids for sweet 16.
That's true. That is true.
But the BBLs and the lip injections and stuff like that at 30, well, what do you think they might look like when they turn 50?
You know, before
they're gonna be a duck
before I answer the question, I'm thinking about how they're gonna look. You know, like imagine the nursing homes in 50 years, right?
Yeah, everybody
It's gonna be awesome in nursing homes.
It's gonna be a hot day.
But the thing is, you know, you want people to notice, not know what you do. You know, if you want your lips to look naturally enhanced, not look like ducks.
Well, I have never wanted to do anything to my lips. Actually, when I was growing up,
your lips are amazing.
Thank you. But when I was growing up, I thought my lips were too big.
Well,
who knew that lips were gonna be in style?
Yes.
I was always like, oh my gosh, my lips are like too big. Why do I have big lips? And you grow into your looks. Over the years. But women who are in their 30s that are having BBLs now, so do you think when they turn 50, they're going to have to do it again?
So great question. What happens is, as you get older, you gain more weight. Mm-hmm. So the BBL, when it's overdone, grows with you.
Oh, so it gets bigger.
You know what? A lot of the things I do right now, I do a BBL reduction.
Oh, now how does that work?
So when people do too much fat,
so it's like taking out like liposuction.
Yes. Oh. It's less intense than BBL, but when you overdo it, I'm sure you've seen people who have big hips and big butts and all kinds of stuff. It sounds good when you're young, but that's too much. So we want to focus more on professional BBL when it's done right. It grows with you, and if you lose weight, it loses weight. If you gain weight, it's more of a proportion, not too much. So we are doing a lot of like BBL reduction right now.
Oh wow, that's amazing. But I know people do reducing their breasts, but I didn't know they reduce their butt.
People are not talking about it. This is really the new trend now. Yeah, a lot of people, those people that had huge butts that were out of proportion to their body, and now people want to look more classy, not trashy. Exactly.
So are you doing men BBL?
Yes, we do men.
How does that work, honey?
We don't discriminate.
Of course not, but I mean,
so I say you do you.
It's the same thing. You do the men just like you do the women. Because I feel like most men are not shaped like women. They're
that's
like,
right. You're right. So there are two kinds of men. There are men that want to look like men, and there are men that want to look like women, and it's all good.
So there are men who are straight that want to have their butt done.
That's right, because their pants can't hold on to the butt.
Their pants.
They don't have a butt to hold on to the pants.
To the belt.
Yeah.
Okay.
Yeah, the men have issues too.
Okay.
So we create the footballer's butt for them. We even have men that do butt implants, and they're straight men. They want to be that, and there are men that want to be like women. And they come specifically, they tell us exactly what they want to do.
They want to be soft and
they want to wear hips. So the difference between men and women have hips, men don't.
Right. So you have to give the man some hips and a butt.
That's exactly.
But I know a lot of men who naturally have butt too.
Yeah.
Naturally got big butt, So anyway, let's talk a little bit more about this BBL because obviously BBLs are very, very popular today. Everybody is looking for a BBL. Now, me personally, Dr. Okoro, I would not consider myself having a BBL. I would be like, can you just fill in these areas like my problem areas or a dent right here or a little scoop over here? Can you fill it in right there? I mean, is that really a BBL though?
So, great question. Again, in the big sense, it's called a BBL, but it's customized to you. So what you see on the Instagram, a young person has a BBL may not be something that somebody who's in the 40s or 50s. So that's why at Georgia Plastic we call it professional BBL because you want to look classy, not trashy. Right. And it's the same name but not the same procedure.
Okay. Not the same procedure.
Yes.
Okay. Now today, to me, I feel like the popular thing is to have a silhouette.
Absolutely.
I feel like that is more classier than the little baby waist like that, and then the real big butt.
Yes.
So how do somebody get their waist this little?
So,
do you take out their ribs?
No, we don't take out ribs. Some people who are born with small waist. So there's three things that control your waist size. One, the obvious one is fat, followed by your muscle and your bone structure. So if you're lucky, you have a small bone structure and small muscle mass, the fat is easy for us to take out. We cannot take out the muscle or your bone.
So you could do liposuction on somebody and they still have a big stomach afterwards? Because you're only getting what's on the top.
Exactly. And so you also have to watch what you see on social media. A lot of times people do Photoshop,
For sure.
and it's not the same. So,
but I do see people in real life with these little bitty waists.
yeah, so they were born. So it's about hip and waist ratio.
Mm-hmm.
We can only make your waistline so small, and the rest we make the hips match. So when the hips are big, the waist looks small. The hip to waist ratio.
I don't like that look.
Some people do.
I know, but can I not have that
No,
look?
absolutely not for you.
I don't want that look. I want the silhouette, the one we talked about
Yes.
earlier. Classy,
not trashy.
trashy.
Yeah.
Okay, so
Team.
so what age I want to know, because I have a girlfriend that's asking about coming in to see you, and she's almost 60. Is there an age where you say no, I can't do you?
Excellent question. So the average patient in our practice is about 50, 55 anyway, average. So we do, my oldest patient is like 87 years old.
Really? I would think that you would not do that.
You know, it's not about the age.
It's about the health.
Thank you.
Got it.
There are some 50s and 60-year-old women that are healthier than majority of my 30 or 40-year-old
I can believe
patients.
that.
Because they eat well,
Yeah.
they work out, they
Right.
run, they're active. Why
Right.
not?
I understand.
Well, who am I supposed to say no to them?
Right.
No.
Yeah, but I just wonder what you say no to. You know, you would say no to someone with health issues.
Yes,
Things
yes,
like
yeah.
that.
If you're worried about your heart, your lungs, your kidney, your liver, plastic surgery is not for you. You
Right.
know, it's so the people that will do procedures are healthy patients. That if you have high blood pressure and it's managed well, yes. If you have diabetes, it's managed well, yes.
Got it.
You have kidney problem, it's managed well, yes. But if you have multiple medical problems and you can't walk up the stairs or walk down the stairs or walk a block, you may have to think about options.
Well, would you tell a patient to lose weight before having liposuction? I've always was curious about that, because why would I lose weight and I want to have liposuction? You should be able to suck everything. But I hear people say that the doctors sometimes say lose weight.
Yeah, so you are so smart.
No, I just look at these girls and
Yeah.
people talk about it.
So there are kind of two types of fats. The fat that we as plastic surgeons can suck out, it's called a subcutaneous fat. You may want to Google this one. Visceral fat. We can control that one. So when you lose weight, we want you to lose some of that visceral fat.
Like BMI?
Well, it's not the same. The BMI is the overall weight structure. But the subcutaneous fat and the visceral fat contributes to the BMI, okay? Which stands for body mass index.
Okay, so if you have a high BMI, then you would be saying no.
So we do have a cutoff for BMI. So for us in IGF class is 40. If you're over 40, we recommend that you do a weight loss, either medical or surgical. We have doctors that we work with around the Atlanta area to lose weight. If your BMI is within the range, then we can statistically do surgery. If we say yes to you, it means you're good.
So, I know you like to do classy and not trashy, but if I wanted a big butt and I didn't have enough fat, would you tell me to gain weight so that you can get it?
No, that's nobody should ever tell you to gain weight for plastic surgery, because think about this. What fat do I want to use? The easy to come fat or the hard to lose fat? Easy come, easy go.
Okay.
If you gain weight, you're gaining weight in the visceral fat and the subcutaneous fat. Then the plastic surgeon will remove the subcutaneous fat, and then you keep the visceral fat. We could do that, but then when you leave, you still have a gut, fat around your organs. So you should never gain weight with plastic surgery. It is not it's not good for your health.
Okay.
It's not good at all. That's a bad idea.
Okay. I mean, I don't know.
Yeah,
but
it's not just bad. It's a horrible idea.
Okay.
Yeah.
Now, let me ask you this about the BBL. So, how is it that some of the BBLs are real high up and some are low. You know?
Yeah. So
Are they putting more fat up here, or are you liposuction the back so the top of the butt can stick out?
So is a combination of both. So a lot of people come to us. They want to have this called what is it called again? A shelf.
A shelf.
A shelf.
Okay, I said a donk.
Yeah, it's just a shelf. So we professionally put fat where they want to eat, and then we contour to make
because
it.
They want to stick out up here
Yeah.
and then go back in right.
Yeah, but we end up doing a lot of majority of the reductions that I do is from that.
From a shelf.
They come back and they don't like it anymore, so we have to do a BBL reduction.
I tell you, there's something about these BBLs. You know, there are lots of guys. I mean, one thing, I'm not a guy, and I look at everything. When I see women walking past with a big dunk, I always look. I be like, wow, how did they get that?
It's again, plastic surgery is about preference. It's about preference. So there are some people that like that look. So when I consult with somebody, I ask them, what's important for you, to you, what do you want, and we go over the different risks and benefits and stuff. And some people want to have that look, we will do it. But majority of our patients here are professional. So we actually call it professional BBL.
Okay. Well, I got to ask you something outside of the BBL a little bit. So, fat transfer, I know you transfer to the butt,
and hips.
and to the hips. So, can you transfer to the lips?
Yes.
Under the eye, the forehead, the smile line.
I'll tell you where we'll touch. So fat is a beautiful thing because it's our body, it's natural, it's your own body, you can't reject it. So we do fat transfer to the face, all over the face, anywhere in the face, temples, cheeks, lips.
Wow.
Even sometimes jawlines, the breast.
I heard about that. I heard about fat transfer.
Yeah, we do fat transfer to the breast.
Instead of implants?
Like we saw, we had a patient today that doesn't want implants. Even though implants are cheaper, they just don't want implants. If you do fat transfer to the breast, be prepared to do it twice because not all of the fat will survive. It's not like that your body is rejecting it, just it will not survive from blood flow. We even transfer fat to other parts of the body, if you know what I mean.
To the penis?
It doesn't work very well, but it works in the labia area.
For the women?
Yes.
Oh, okay. I was like, to the men?
Yes, some it's been done to the penis, but it just does not work well.
Oh, the penis stopped working.
Mm-hmm.
That's a problem if the penis stopped working.
Yeah, that's a problem.
The penis got to continue to work.
Yes, it has to work.
So if you put some fat in the lips, it doesn't mean their lips are going to stay that size.
No, so there's different techniques that we use for the lips. You don't want it to be too big, so you want to look. I mean, I love the lips because whenever I do fat transfer to the face, I always do the lips actually because the good thing about fat is it's permanent. Once it survives, it's permanent for a long time, right? I mean, they say not as permanent, but which is true. It lasts longer than a filler.
Right.
With a filler, the fat does, yeah.
But you lose a lot of fat.
You lose about half of it, which is fine. But then you gain fat. It's like is a cup half full or half empty. So if you're positive, you say, well, I've gained half of what you have. And most of the times, the half that you gain is just enough.
I would love the fat transfer in the face and stuff. I would. Like, I don't do anything in my face right now. I don't use Botox. My forehead is wrinkled. You actually told me that I should use Botox. And I was like, I partake in Botox. I do every 3 months. I think Botox look great on men. We will talk about that. I do. Actually, every guy I've ever seen. It does. Men, we have a lot of men that come here and get Botox. Of course, the majority of our patients are still women, but we do have men that get Botox. I mean, I get Botox. I'm a man. I get Botox. Yeah. My husband tried it a few times. I thought he looked amazing. I'm not kidding. I thought he got the Botox one day, and like 3 days later, I was like, dang, you might be 10 years younger. Yeah. I mean, we need to talk about your forehead. My forehead. Well, when you're acting or you're doing television, you have to have some sort of expression.
So, perfect. So, a lot of women are scared of Botox because they think we're going to freeze their whole face. Again, it's about the technique.
Okay.
Like, I've had Botox. Don't you see my expression?
Not really. Now I see.
So,
Your eyebrows can move.
exactly. I can still move.
Right. So
But
a lot of times you can't.
That's so. It depends on who's doing it, right? You want to do it so it looks. So you want people to notice, not know what you had done.
That's right.
So I tell my patient, if your face is frozen, it wasn't done by me.
Okay.
We want to freeze the wrinkles but free your face. How about that?
Okay.
Freeze the wrinkle and free the face.
Okay. Well, are there any questions for us about a BBL, Grace?
Let's see.
Or anything in plastic surgery?
Any plastic surgery questions, guys? We did have some questions about post-op care and how that recovery goes. Particularly a lot of questions about abdominoplasty and tummy tucks.
Oh.
I know.
Well, we do a lot of tummy tuck, and I hear tummy tucks are a lot more involved than the BBL. Of course, the people who are wanting tummy tuck are people who have had kids. If you have kids, you have a lot of skin hanging out on your muscle. It's separate. It's called rectus diastasis. We remove the excess skin plus excess fat. So we do combination of liposuction and tummy tuck, and then we repair the muscle.
How's that scar?
The scar is at the bottom,
So you can't see.
once it heals, most of our patients are still able to wear a two-piece.
I've heard people say that they have had a mini tuck.
Yes.
Now, what's the difference? Because that one line is a long cut.
So the length of the skirt does have nothing to do with mini or full tuck. It all depends on the amount of skin that has to move. The difference is in the mini tuck, we're not repairing muscle, and we're not.
Oh, you do not.
We don't have to. It's usually for if you've had a C-section and have skin hanging over and a fat, so we do liposuction. And then we remove all of the excess skin, and then we tuck it. And we're not moving. There's no scar around the belly button with the mini tuck. Mini tuck is one of my favorite tucks.
Okay.
I love it. We call it ATL tuck.
Oh, that would be really great for like mommy makeover.
Absolutely, I love mini tuck. Mini tuck combined with a BBL. Oh, that's the ultimate moment with makeover. Oh yeah.
Okay, well, anything else, Grace?
Yeah, so we did have a question regarding whether or not you guys use local anesthesia or general anesthesia.
We're talking about that before. So we use both. A lot of people are scared of general anesthesia, but as long as you're healthy, we talk about health. Health is the biggest thing. If you have your health, you are good. Not everything can be done with local anesthesia. Like I was telling you before, I've done local anesthesia for a long time, and a lot of times most people can't handle it. It's actually sometimes even more dangerous actually. So you're moving, you're crying, and the doctor can't even do a good job, and you end up doing a revision surgery. So it may end up costing you more. So if you're healthy, talk to your doctor. You and your doctor should make the best decision for you. So you can't just say no general or no local. It's better to have a consultation and see what's best for you.
Well, I have a question. Maybe some of the people that are watching might have. Is there a consultation fee if they come here to Georgia class?
Yeah. We charge a consultation fee because it's just so much information that's given you, and we spend so much time before you get here. We prepare. You know, if you're doing a free, most elegant and board certified plastic surgeons, is a difference. We will charge a consultation fee. The more experienced and trained doctor, the more likely you are to charge a consultation fee. So we don't do free consult. We want people. I mean, if you can't afford the consultation, you have to afford the surgery. You know. So.
Well, but that fee will go towards the surgery.
Absolutely.
Right?
So we apply it towards. So it's really not. So you should do your homework before you pick your surgeon, and then pay the consult. If you don't pay a consult fee, they are just usually pushing to get you to book surgery. It becomes a high profile sales pitch.
Okay, so I know the people that are listening or watching this live right now, they hear your accent. So why don't you tell them where you're from? Because you're definitely not from Atlanta.
How do you know that?
Because you don't sound like me.
No, I'm proudly from Nigeria, born and raised in Nigeria, and I'm proudly American as well. Born and raised in Nigeria, grew up in the US. I've been here for over 30 years.
Okay, so
Yeah.
you're peach. You're Georgia peach.
Yes. I moved to Atlanta 1996.
Oh, you never lost your accent.
No, this is what makes me unique.
I know, sure.
Yeah, I don't want to lose my accent.
No, I don't want you to lose it.
Yeah, no, I love my heritage. I love, all my kids were born here. I'm a Nigerian American. People say you're African American. I'm Nigerian American. There's a difference.
I'm African American.
Yeah, but I'm Nigerian American.
You're Nigerian American.
That's right.
Okay, I got it. There's a difference.
There's a difference.
There is a difference.
If you ask any Nigerian, they'll probably tell you.
So why don't you tell them about you're not just here in this practice by yourself. You do have a couple of other doctors that's here just in case.
So
if someone is curious about using a meal or something.
Yeah, so there's three of us, myself, Dr. Daniel Park, and Dr. Paleva Kumbla. She's a female plastic. So we do have a female plastic surgeon, and they're both great plastic surgeons, well trained. I may be the face, but there's other people I can do everything. They're excellent. Anybody that's here, we vetted them very well, and they are safe for you.
So why don't you also tell them about your lovely spa? Because I didn't even know you guys had a spa.
Oh my God, that's the best
very beautiful.
Kept secret here. So the Georgia plastic is surgical. So, but there's some people that will never want surgery. So we have all of the non-surgical stuff in the spa. We have more non-surgical equipment than any other spa in Atlanta. We have everything from cool sculpting to M sculpt to Tamiva to Tommy Smooth, Hydrofacial, Botox, and injectables, and RHA, all kinds of stuff that have laser hair removal. We have a lot of non-surgical stuff. Plus, after your surgery is done, all of the surgical, non-surgical maintenance is done in the spa.
Okay.
It's world-class spa.
You also should tell them that you have your medical, your facility, your surgical center here on Providence.
Oh yes, oh my God, thank you.
Yeah.
So the surgery is great. Where is my surgery going to be performed? So you want your surgery to be performed in a well accredited facility.
Yeah.
It means the level should match or exceed the level of accreditation to the hospital.
Okay.
So our center is well accredited, and we perform over 500 surgeries a year.
Wow.
So and it's all safe. Not all is good.
All is good.
Yes.
It's good. It's a very beautiful place here. I was actually shocked when I went to the spa. The spa was beautiful. I was like, wow, I didn't even know it was here. And it actually is very deceiving because it looks small when you
On
put
the
it
outside,
here,
yeah.
and it's very big back here.
Yeah, because we're on a major road and it's on the slope, so it's a 14,000 square foot place.
Yes, very, very nice. So any other questions for us, guys?
We did have one question that they were asking a lot, which was, what's the difference between butt shots and a BBL, and a lot of butt shots questions.
Wow, so I was lucky enough to be involved in one. I think, what was the show?
Yes, it's on Hulu. It was on Discovery Channel, National Geographic.
National Geographic. So they came here to interview me a few months ago about the bus shots. So
that's right.
I mean, nobody should be doing bus shots. If you go to a hotel room, you should know it's not normal. And it's dangerous. People are dying from this.
Isn't there some shots that are okay to give? Like they are giving, some silicone shots that are on the market, not like off the market or you're in somebody's garage.
There's no silicone shots legal.
Well, maybe I'm using the wrong word, saying silicone, but
the other place that we can inject in the bottom.
right.
Yeah.
Okay.
So
can we put in there?
you do a filler. There's all kinds of filler that we can use, but they're not as much in terms of volume. Your fat is still your best option. Your fat is cheaper, it's safer, and it lasts longer.
Okay.
So, but if you're doing the other shots, you're putting yourself at a greater risk of injury or death, actually.
Because I had thought about a butt shot before. I just never did it because I'm scared for somebody to stick me. But I actually was like, maybe a butt shot would be better than actually,
Yeah, we use fillers such as sculpture, remover. Those are the things that we use. Those are the little stuff. But some people are still injecting silicone because you can buy it, and these are industrial grade silicone from a hardware store.
I feel like if you get a butt shot, I feel like the only person or the only people that should be getting butt shot are people that's already have a nice behind and maybe they just want to fix a little dimple or like just touch something. But I mean, you certainly can't get a whole BBL with some shots things.
Yes, I agree. So that's what we use it for. And there are some people that have no fat at all. They have no fat, and then that's But I tell you what, I teach.
Some of my fat?
We're not there yet. There's some people. There are people working on that right now in research. We can use other people's fat. It's called remover. Okay.
Yeah, like to get some of mine.
Yeah, but if you don't have enough fat, we have bone implant that works well.
Implant?
Yes. So I do a lot of bone implant. I teach a course.
Yes, I've seen a couple of people actually work with a person.
You wouldn't know if they have a bone implant.
Well, I actually knew they had one.
Okay, if you knew
it wasn't done, very hard.
It wasn't done well.
Okay.
Yeah. So if most of my patients that have bone implant, you would never know they have bone implant.
Okay.
Because we put it under the muscle and the muscle covers, so it takes the shape of the muscle. How would you know?
So it looks good?
It looks good and it's permanent forever.
So is that better than fat transfer to the blood then?
Fat is better because there's no foreign body.
No foreign.
Okay?
Yeah.
But if you don't have fat, the next thing should be a bottom implant. And it shouldn't be too big. It should look natural. Classy, not trashy. So you use the birth implant, and then we can use other things to. Sometimes if you don't have enough fat, and use the butt implant first, and then use your own fat to kind of do some feathering. So it should look as natural.
Practice.
The last question is no.
Right.
No deaths here because we select our patients very well. We talked about health many times. So I finished medical school in 1996.
Okay.
So I've been a doctor for over 26 years, right? And been a plastic surgeon for over 15 years now. So lots of experience, lots of training and experience, and yes. So I'm very, very proud of my training and experience. And our result speaks for itself.
Okay, so the results speak for itself.
That's right.
Anything else, Grace?
Any last minute questions, guys? We did have some specific medical questions about diabetes and high blood pressure. For those kind of questions, please click the link that is pinned, georgiaplastic.com, in order to schedule a consultation with Dr. Okoro, Dr. Park, Dr. Kumbla, one of our PAs. You can use those resources in order to ask those specific questions. Any other general questions? I think that is about it. Well, we did have some questions about post-op, though. The post-op process. We know we have a Machi Med Spa there for the lymphatic massages. So give us a little bit of tease about that.
So after you have surgery here, the post-op is part of your package. We have over 5 estheticians that will take care of you. With everything that you need. We are all-inclusive places, like you go on all-inclusive vacation.
Yeah.
Georgia Plastic is all-inclusive. We don't make like down patients. So everything from your garments, so we provide everything that you need. All you need to do is just show up. Everything's provided for you.
Okay.
Awesome. I think that is all. And for all of the questions about body contouring, cool sculpting, M-Sculpt, all of those, please follow Amachi Med Spa. That is where all the non-surgical things are. Dr. Crow's, he's surgical. He wants to do some lipo on you. Any more questions, guys? I think that is it.
Before we go, Dr. Okoro, you should tell them a little bit about your foundation, and you should also tell them, for those who may be watching from out of the country, that you do go back to Nigeria and you have a place there where you do perform some of these same things.
Yeah, so we do, thank you for bringing that up. I'm from Nigeria, so I do believe in giving back. Mm-hmm. So I travel to Nigeria every 2 months to provide plastic surgery. That feeds our foundation. We have the Georgia Plastic Foundation. Because believe it or not, there's some people that don't have access to good care, access to health care, access to anything. So I believe we are blessed to be a blessing to others. Yeah. So I bless other people in my hometown and in my state there. We give them free care. They go once a month. And we hire the doctors and the nurses that see them, and we provide them with free medicine, free health care, and if they need surgery, we pay for it. And we also sometimes, when I'm there, I perform the surgery myself as well.
Okay.
So I perform the surgery. We also hire, obviously I can't be there all the time, we hire surgeons, and the foundation pays for the surgery as long as they're poor, you can't afford it, and we also provide scholarships to the orphans as well.
That's very good.
And we teach them computer skills so they can get a job and be productive and give back.
Very nice.
You know,
yes, very good.
that's Georgia Plastic Foundation.
Georgia Plastic Foundation. Yes, so thank you guys so much for tuning in to me and Dr. Okoro here at Georgia Plastic Surgery. I'm going to be doing some fun things soon that I will be able to share with you guys. I can't wait.
Thank you very much for tuning in today. Thank you. Bye.
Bye, guys.
Bye.